Welcome to Pharmaceutical and Medicinal Chemistry. Module 2 of this course is Drugs, Nomenclature, Classification and Administration. Chapter 2.3 in this module is Administration of Drugs. Learning outcomes. By the end of this chapter, learner would be able to comprehend the meaning of drug administration, identify various drug administration routes, differentiate between the enteral and the parenteral route of drug administration, correlate the drug administration route with its advantage and disadvantage, and establish the ideal route for 100% bioavailability of the drug. Contents. Meaning of drug administration, factors influencing choice of a route, enteral, parenteral, and other routes, and finally, the 5 rights of medication administration. What is drug administration? Drug administration is basically the route or the mode through which a drug is introduced into the body of a person. Drug administration basically means giving a drug, administering a drug. In this chapter, we will know more about the various options or the various routes through which a drug can be introduced or administered into a person's body. Now, let us see what factors influence the choice of a particular route. For example, we know very well right from our childhood, we must have taken some or the other medicine at some or the other point of time. For example, we must have swallowed a particular pill like paracetamol, or we must have applied a particular ointment or some balm for a pain, or we must have gone through or taken an injection. You can realize now drug can be swallowed, drug can be applied in the form of a paste or a cream, drug can be injected. These are the popular routes, but there are also several other routes through which drug can be introduced into the body. Now let us see what all factors need to be taken into consideration before narrowing upon a particular choice of route. First factor is physicochemical properties of the drug. Now, if the drug is made up of large molecules or protein molecules which are likely to be hydrolyzed in the digestive tract, that drug is generally not taken in the form of a pill because digestive juices are acidic and there is a probability that the drug molecule can be hydrolyzed or broken down by the acid that is there in the abdomen. So, physicochemical properties of the drug decide which particular route is to be taken for administering the drug. Then, relative rates and extent of absorption in different routes. Some routes are preferred if the rate of absorption is more. Some routes are preferred if the rates of absorption are slow. Extent of absorption refers to how much of drug is absorbed in a particular route, and also intended site of action. If the site of action, suppose if I have headache, I apply a medicine or an ointment to my forehead or my head. If we have a pain in the leg, a particular medicine in the form of a spray or a patch is applied to the leg. So, the mode of drug administration or the drug administration route also depends on intended site of action. What is first pass effect? We know in the previous discussion under pharmacokinetics and pharmacodynamics chapter, we have seen what is first pass effect. first pass effect is a particular metabolic activity occurring in the liver which will reduce the concentration of the drug even before it reaches the target site. So, if a particular drug is required in a very precise concentration at a particular site, then generally it is advisable to avoid the first pass effect route. First pass effect is characteristic of enteral routes. Enteral route means that if the drug is swallowed or if the drug is passed into the alimentary canal or the digestive tract, then definitely it has to go to the liver. If liver reduces the concentration of the drug, and if you do not know how much exactly the drug is going to the target site, then we say better avoid the alimentary canal or the digestive tract. So first pass effect is one factor which will decide the route of administration of drug. Then effect of in situ chemicals on drug absorption. In situ chemicals refer to existing chemicals. See, we are introducing the drug into the body. Suppose if it is swallowed, the entire digestive tract, right from mouth to intestine, we know intestine is the place where drug absorption occurs, but before the drug reaches the intestine itself, it will have to come in face to face with several chemicals that are there in the digestive tract. So what is the effect of these chemicals on the drug? If it is adverse effect, or these chemicals are causing some unwanted change in the structure of the molecular structure of the chemical or in the properties of the chemical, some unwanted change, then you don't follow that route. So what is the effect of in situ chemicals is one factor which will decide a particular route. Before you decide on a particular route, you consider that factor also. Most important factor is condition of the patient, affordability and convenience. Condition of the patient, if the patient is a bedridden patient who can't move from the bed or who is in an unconscious state, you don't give a medicine through the mouth because the patient cannot swallow it. Similarly, affordability, suppose a particular medicine can be simply taken in the form of a pill, we always prefer to take it as a pill because getting injected requires additional expenditure, additional people. You need to go out of your home, go somewhere and get the drug injected. So all these factors, physicochemical properties, relative rates of absorption, extent of absorption, intended site of action. First, suppose intended site of action, if the problem is somewhere deep in the abdomen in the form of an appendix, then you can't apply the drug in the form of a paste or a cream, right? Something needs to be done internally. So intended site of action, where is the site of action, and is there any first pass effect associated with the particular route? Effect of in situ chemicals, condition of the patient, affordability and convenience, all these factors decide on the particular route of drug administration. Now, the from the preceding discussion itself, you must have understood basically there are three basic routes through which drugs can be introduced. The enteral route, which is the digestive tract, right from the mouth, to intestine. The whole of digestive tract is called alimentary canal. This route is called as the enteral route. What is parenteral route? Parenteral route is the route which bypasses or which avoids the alimentary canal or the digestive tract. Apart from the enteral and the parenteral route, there are other routes also which we will discuss in the present chapter. We can see enteral route, it involves the alimentary canal. You can see in the picture here. See, a particular person is swallowing a drug, that is called the oral route. Orally administered medicines can be in the form of capsules, pills, lotions, or it can be in the form of a tonic or a suspension, or generally not gel, but suspensions are okay. So those are called as the oral drugs, and the route is called as the oral route. Now we know very well oral route is safe, it is convenient, it is cost effective. You need to bear the cost of the medicine only, no other cost is involved, and it is most commonly used right from our childhood. We also take it just like that. If you are sick and you know that you are having some headache, if I take this medicine my headache will go, then obviously we'll choose one pill, some ibuprofen or some aspirin, and we will simply swallow it. So this is the oral route, solid or liquid, swallowed or chewed. We know some vitamin tablets, especially C vitamin, we always chew it, we are advised to chew the tablet. So swallowing, chewing, and this particular route is preferred for chronic illness. Supposing you are expected to take a medicine for a long period, let us say for a course of 10 days or 5 days or 1 week, at the rate of 3 pills per day or 2 pills per day, and the oral route is the most preferred route because you can do it on your own. Simply purchase the medicine, whatever the doctor advises, keep it in your house, and exactly after every 8 hours or every 6 hours, if you are asked to take the medicine, you can take the medicine without the help of any health assistant. Okay, but there are certain disadvantages associated with this route. The disadvantages are it is slow, the action does not start the moment the medicine enters your abdomen. It will take some time, and low rate of absorption, unpredictable because of the first pass effect. I have been telling you, enteral route has the disadvantage of first pass effect. That means concentration of the drug will be reduced formidably before it reaches the site of action. So we do not know exactly, you cannot predict how much drug is going to the site of action. And also, as we have already discussed, there will be intestinal influx and efflux. Means certain chemicals that are there in the intestine will push, if the chemicals push the particular drug back into the intestinal canal, then it is what is called as efflux. That means you want the drug to pass through the wall of the intestine and enter the portal circulation, but because of the efflux, it is pushed back into the abdominal tube or into the tube of the intestine. There are some chemicals that cause influx, there are certain other chemicals that cause efflux, first pass effect. All these are the disadvantages associated with the oral route. And NSAIDs refers to non-steroidal anti-inflammatory drugs. These non-steroidal anti-inflammatory drugs can irritate the track of the intestine, and they can also cause ulceration. So these are the disadvantages and advantages of the oral route. Next, sublingual and buccal roots. You can see in the pictures that are put here, all the images have been sourced from open sources on the Google. So you can see the sublingual route is putting the medicine beneath the tongue, and buccal route, you can see here, is placing the medicine between the cheek and the jaw. That is in the buccal cavity. The medicine is placed in the buccal pouch, it is called, between the inner wall of the cheek and the gum. It is placed there. This route is also considered as enteral route. Sometimes you can also swallow it. No, when you are having the medicine under the tongue, it can also happen that you will swallow the medicine. So it is grouped under the enteral category, and it is a solid form of the drug only can be taken through this route. It is safe, it is convenient, it is cost effective, but whether exactly it bypasses the first pass effect or not depends on whether you have swallowed a portion of the medicine, or you simply left it like that in your mouth for it to permeate into the blood capillaries that are there lining the mouth. See, sublingual means the area under the tongue is provided with a rich supply of blood. So whenever a person is in angina or heart attack, or the person is likely to get it, then the doctor will say put the medicine under the tongue and leave it like that. So once the drug is kept under the tongue, it will dissolve in the saliva that is there, and immediately the rich source of blood, blood circulation is there. So into that blood, this particular drug will diffuse, or you can say it will simply move from the sublingual cavity into the blood that is lining the particular area. Now, but in the buccal region or the buccal pouch, it's not so rich in blood circulation. Absorption will be slow. And also, one disadvantage with this particular route is that only low doses of drug can be taken, because you don't have so much big drug you can't keep under your mouth or in the cheek, between the gums and the cheek. Dosage has to be low, and only solid form of the drug should be taken, and you should avoid swallowing the drug. Then only maximum and instantaneous effect can be felt. Because of the rich circulation of blood, immediately the drug will go into the blood and it will start its action. But it is incomplete absorption and erratic absorption also. You do not know how much has exactly gone, how much has gone into the digestive tract. Erratic, we cannot be very much sure, but you can be sure of one factor, that once the drug is placed in the sublingual cavity, it will start its action almost instantaneously. We know nitroglycerin is used in times of angina as an SOS drug, savior of the situation. SOS stands for savior of the situation. So nitroglycerin is an SOS drug which is introduced sublingually to a particular patient. Then we go ahead with the enteral route. Next route is the rectal route, through the rectum. You can see a particular nurse is introducing the medicine through the rectum. So what all medicines are taken orally, they can also be taken through the rectum. But it's not very convenient, so it is not so much preferred. You need some assistance to adopt that route, so it is not so much preferred. The drug is introduced in the form of solid suppositories or that are made out of wax, because it has to travel smoothly into the rectum from the anus. It is made into a suppository with wax and then introduced. There's no risk of vomiting. In the previous modes, oral drugs or the buccal route or the sublingual route, there is a risk. Supposing a person is totally intolerant, is having nausea, is not so comfortable, then there is a chance of bringing the whole thing out in the form of a vomit. But this particular route doesn't have that risk of vomiting. It will bypass the first pass effect. You need, because the rectum is after the liver, it's generally it bypasses the first pass effect. Quick absorption as well as effect. It is very inconvenient, so not preferred so much. And unpredictable and erratic absorption, especially enema drugs. If a person is suffering from constipation, or children will have this problem. If children are suffering from constipation, or aged people are suffering from constipation, this particular route is preferred. Thank you.